Minnie presented in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal, and basically, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think probably about a year. And so it had got so bad I couldn't even wear a shoe, so that's what really made me came in, to have surgery on it.
The next step was for us to take an x-ray and to evaluate her foot and determine what kind of surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better, no pain, it just felt better. And I was so happy, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump, because first it gets red, and next thing you know, you have a wound. And that can be problematic, because then you can get an infection to the bone.
I mean, it's not sore or nothing, it just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. A lot of people are concerned that they've heard from their neighbor, or they know someone at work who's had the surgery, and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and keeps it nice and numb. Because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients. Really, 2 weeks of just not putting weight on it, and we've really come a long way with our surgeries.